Hey, welcome back to the Retirement Adventures of Ray and Carrie. The one thing that we want to share with you is medical and medical services and insurance and all of that. You know, a lot of things that people have asked us, at least especially our family, and what we were concerned about is what are we going to do with medical when we travel? You know, we both had jobs and we both had, you know, pretty good insurance plans, and then we decided to leave the country. You know, what kind of medical services are out there? And you'll be surprised that, maybe you won't be surprised, but we have had nothing but great medical care so far, especially in Portugal, which we're going to share about today.
Yeah, so one of the first questions we discovered when we retired early, or one of the first obstacles, is that since we were too young to get Medicare, that's one of the reasons that we decided to move to other countries, because there are other countries out there that the rating of the health care is higher than the US, but the cost is significantly lower. And Portugal is one of those places. We have been really pleased. We knew we were coming here. We made lots of plans when we get here, for me to get a mammogram, for us to get dental work, for us to get our physicals done, blood work, prescriptions, all of those we knew we were going to get done when we were here. But we just had no idea how excellent it was going to be. First of all, do we have medical insurance? We do have a plan. It's an annual travel plan through Alliance. It's for catastrophic care.
It's like major medical issues, right?
Right, like if one of us breaks a leg or has a heart attack or something like that, and we have to be hospitalized. So we do carry a plan like that. When we get back to the States, we will apply for Affordable Care Act insurance in the state that we live in Arizona. But while we are in Portugal, first of all, I wanted to tell you, Ray hurt his leg, and so we had to take Ray to get his leg checked out. And when we did, we found out that for $120 each, we would become part of a discount plan, and we were part of something like that in Mexico as well. So we bought this plan, and with the plan, your office visits were greatly reduced, dental care was reduced, prescriptions, that kind of thing. So x-rays. So yeah, Ray hurt his leg. He went in. It was only $30 to see the doctor. Really good health care. Found out he just had a sprain, and so.
Now I know you're all wondering, how did I hurt my leg? On a golf course walking.
Yeah. Anyway, so then next, I went ahead and made my appointment for our annual exam, and the doctor ordered $260 worth of blood and urinalysis tests, which was a lot. We only paid like $215 for all those tests. And then I met back with her, and she went over the tests with me and made sure that I was on the right kinds of medications that I have. And so, and that was a really positive experience. The next positive experience that I encountered was when I went to get my mammogram, and in the States, I think it's in the thousands. Typically, a mammogram is in the thousands if you have to pay out of pocket. It cost me $93 with that discount card that I had. And in that time, I was in the office for a full hour, got the mammogram, waited for 10 minutes while the doctor reviewed the mammogram. And then I met with the doctor, who they always follow up with an ultrasound also, just an additional check of your breast. And she went through the mammogram with me on the spot and told me that I was clear for another 2 years and nothing to worry about. And so that was really exciting. I am just so pleased with the quality of the care that we've received in Portugal, and would not hesitate to come back again.
Right.
The next thing we want to mention is the cost of prescription medicines. A year ago, we were living in Ensenada, and we had gotten our physicals done there. We had received prescriptions for all of our medications, and I was taking 7 medications at the time, and Ray was taking 1. And we bought all of them, and I was thrilled that we paid less than $1,300 for a year's
worth.
worth of prescriptions. And so that was great. Well, here in Portugal, for the same prescriptions minus 1, I don't need 1 that I was taking, for both of us, for 1 year, our prescriptions only cost us $350. So that is amazing.
Yeah, so that's the other thing that you have to remember is that, if you have prescriptions or you're going to need them, you're going to be traveling, think about getting them, in the different countries, because you're going to save a bunch of money. And we did here, and it was really helpful because we're going to be traveling again, and we're going to be taken care of for the next year of all our medications. So it's pretty cool.
Yeah.
One of the things that we were here a year and a half or so ago. And it was our first experience going out of the States for a long period of time, and we were in Portugal for almost 2 months. I think it was the last time, and we knew that the healthcare was really good the first time we were here. And it just so happens, we'll just say the little trip and fall that Carrie did along the boardwalk, smashed her face, blood everywhere. I wasn't there. I was a little ahead of her on our daily walk, and some gentleman came up and helped her, called an ambulance. An ambulance came, took care of her. It was a fully loaded ambulance. A guy and a gal were there. I got there. The ambulance had Carrie, and when it was all over, we didn't know what to expect. So I'm taking out my ID and my credit card and all of that, expecting that I needed to pay something for an ambulance, because an ambulance visit in the United States is going to cost you a couple thousand, even if the hospital is just around the corner. It was absolutely free. And I was blown away by the care, and obviously the cost was nothing for the ambulance. But just the medical care in general has been really, really good. When we went in for our blood work, I was, you get the needle in there, and then they only do 1 tube, which was really weird. Instead of, each vial that they take, back in the States, they pop it in and take it out and put it down. But they take the 1 vial, and then they fill up the vials. And, I asked the guy, why do you do it that way? He goes, well, it's more cost effective that way. And, so they're really cost conscious, if that's the right way to put it. And then also the dental care that we got here. I'm really paranoid when it comes to doing x-rays. I have this gag reflex, and so I really hate getting that little tab stuck down your throat to get the x-rays. This one here, they had the full 360 x-ray machine that does a 3D model of your mouth and all of that. And again, we asked them, well, why do you do it that way? Why not the regular? They go, well, that's a little outdated, and this is more cost effective to do it this way. And so that was really good. The dentist was amazing.
Phenomenal.
They just gave such great advice and tips, and do this and don't do that, and great quality care when it came to the dental. I think our doctor, we both had the same doctor when we went in for just our general practice stuff, getting our blood work, urine analysis, and all of that. And I think we had great care in the U.S. It's just a matter of if you're deciding to retire and go somewhere, medical is important, and you want to know that you're going to be provided for, and that it's going to be good quality. And Portugal offered great quality health care. So, our advice to you, if don't let, health insurance stop you from traveling. Do some investigation, look out there. There's a lot of different countries out there that provide really top quality care. And we're so fortunate being here in Corteira in Portugal that we've received nothing but the best so far. So our advice for you is, just continue to dream and continue to travel safe, but also understand that there's a lot of great healthcare out in the world that I think you'll be pleasantly surprised with. So we'll talk to you later. Bye.